As the Chair said, my questions are fairly short and straight to the point. So, what is the latest guidance from the Commission on COVID vaccine mandates? Where was that published?
We're just getting Commissioner Finlay to the table.
Good evening, Senator. Commissioner Lorraine Finlay, Human Rights Commissioner with the Australian Human Rights Commission. I'd refer you to the previous answer that we gave you in relation to this at the previous estimates. The advice remains the same in terms of the general human rights principles that we rely on in terms of our approach both to vaccine mandates but also all other restrictions that were imposed during the COVID-19 pandemic.
Thank you. And I must compliment you and express my appreciation and admiration for your stand on being so clear on the voice and on misinformation, disinformation. And I want to thank everyone for being here tonight to do that. Are you aware of the evidence from the Secretary of the Department of Health and Aged Care, Professor Brendan Murphy, at the previous estimates in regard to COVID mandates?
In a general sense, Senator.
On June 1st, Professor Brendan Murphy said that, quote, "At this stage in the pandemic, there is little justification for vaccine mandates," end of quote. That's the most senior health bureaucrat in the country who said that. There doesn't seem to be any updated guidance from the Commission on vaccine mandates, despite the fact they are still in effect at employers and are clearly a breach of human rights that's not proportionate to any benefit, supposed benefit. Why haven't you come out clearly on this issue?
Well, Senator, I'd answer that in two respects. The first is that the guidance in terms of the general human rights principles remains the same. We're not medical experts, and I think we discussed that at the previous estimates, but our advice is based on those general human rights principles where in emergency situations, of course, governments can restrict individual human rights, but those restrictions need to be proportionate, non-discriminatory and targeted to risk. So the advice remains the same because it's the general principles of international human rights law that we rely on in terms of informing our views about these things. So those don't change.
So you essentially follow blindly as a commission because the Chief Medical Officer, he advised me in March of 2021 that the severity of COVID was low to moderate, not severe. So it's not a crisis.
So, no, Senator, our advice doesn't follow blindly, but again, I'd refer back to the evidence that we gave previously and note that, for example, the most recent TGA advice in relation to their vaccination safety report repeated the same advice that we discussed at the previous estimates in terms of the benefits of the vaccination outweighing the risks, and it's on the basis of that the general principles of human rights law can then apply.
So, and I appreciate that you probably haven't got any latitude to investigate, but the TGA has told me in Senate estimates in February, I think it was, that they did not test the injections. They relied on the FDA in America, which did not test the injections, relied on Pfizer, which shut down the trial because of the horrendous results.
I can't provide any information.
No, I wasn't expecting you. I'm just...
But perhaps we'd just refer to the second aspect of the answer that I was meaning to get to, which is, of course, we'd welcome the opportunity for these issues to be explored at the COVID-19 inquiry that's been announced. And certainly we have made public comments in relation to that inquiry about the need to not only look at the economic and scientific impacts and advice that were given throughout the pandemic, but the human cost of the pandemic as well.
That's refreshing to hear. Thank you. Let's move on to the voice.
Senator Roberts, we don't have time to move on to the voice right now because we have to go to a break.
Okay.